Hi, everybody. Great to see you all on the call. It is my privilege tonight to introduce the speaker to you. It is Herman, all the way from the Strand near Cape Town. And he is going to share about autoimmune diseases with us. He is highly qualified. He has about 7 diplomas in nutrition. He have an honors degree in sciences. So he really know what he's talking about. So listen up and take notes. Over to you, Herman.
Hello everybody, thank you for the introduction. Yes, autoimmune disorders, quite a relevant topic nowadays. Just for clarification, it's not the automatic immunity a husband has to his wife's moaning. It's not that autoimmune disease, okay? Not that type. Let's be a bit more serious now, okay? Just my qualifications, to show some people that I've got some qualifications as well. And also, please, a disclaimer. This whole talk is from a primary healthcare perspective. It doesn't mean to replace a doctor's prescription. Just contain things that I would do if I, for example, had one of these conditions. And it's just from, like I said, from primary healthcare perspective to help people have healthier, better lives. Some background information. We know that during natural birth, a baby exposed to a mother's birth canal fluids. These canal fluids contain very important ingredients. And so very often babies get born by a cesarean section, so they miss out on this. There's some gynecologists nowadays and obstetricians that during cesarean section, they take a swab from the mom's birth canal and then swab it on the baby's mouth. So the baby can expose to those ingredients, which could be bacteria and so on. Furthermore, as the baby drinks breast milk, his digestive tract is colonized by bacteria. So it's very important for the baby's immune system to develop. As a child grows, more bacteria species colonize the gut, in other words, and they extract nutrients and energy from food. They protect against pathogens. They're a very important part, therefore, of your immune system. Okay, and they also synthesize vitamins like vitamin K, but they also synthesize lactase, which is an enzyme that digests lactose. So people with allergy problems or lactose problems, it might be that you lack probiotics. In any case, a healthy immune system defends the body against all these invaders, like pathogens, germs, toxins, and allergens. Okay, you get lymphocytes, killer cells, and all these things. Okay, CD4 cells, and they all play a role in trying to destroy germs, pathogens, and keep it healthy. But what if something goes wrong in this process? And that's what autoimmune diseases are about. Let's go on. Like we say, it develops antibodies and therefore helps fight disease. Now, autoimmune disorders develop when the body's immune system attacks and destroys healthy body tissue. By confusing healthy tissue with germs, for example. I myself, when I was 14, had rheumatic fever, which is an autoimmune disease, but fortunately, it lasts about 6 weeks and then it's over. It's not a permanent one. Okay, interesting enough, 1 in 12 people will get an autoimmune disease in their life, 1 in 9 women. So women tend to get it more than men. 24 million Americans, double the number of people with cancer, by the way. And it says women is 8 times more likely to have an immune disease than breast cancer. So it's actually a bigger threat in terms of quality of life than breast cancer. The immune system gets confused and cannot distinguish between healthy tissue and a target. So, what is a cause? They're not 100% sure, but it's a combination of factors. Can be toxins, microorganisms like bacteria that confuse the immune system with toxins and microorganisms. There can be genetic factors as well, which make you more susceptible. Okay? Obviously, environmental factors as well. If you come in contact with specific medications or stress and so on. So let's look at causes in a bit more detail. Autoimmune disorders occur mostly in developed countries. Now, this is quite an interesting one. And this gives us a clue. People in poor nations without modern immunities don't get these diseases. Now there's a clue in that. Think about it. More than 90 medications from more than 10 drug classes have been implicated in causing lupus. And we're very quick to grab medication for whatever disease we have. And we're not thinking about the possible consequences. That's one of the reasons why westernized societies tend to have more autoimmune diseases. One of the reasons. Another one here, drugs have also been implicated in other autoimmune diseases other than lupus. So it's not just lupus. So, yes, medication. So don't go so quickly for those medications you like to take. They're not always as safe as people make them out to be. And be careful, drug companies also can lie. I know that Arkansas State is suing a big company for a certain vaccination they made, and they claimed it is safe for pregnant women. In the meantime, they knew it was not safe for pregnant women. And that was only one of the things that have been taken to court for. So don't always believe your pharmaceutical companies. They don't always tell the truth, although we want them to. Now, if their drugs can cause this type of problem, then would they really want you to know the truth? I'm being devil's advocate here. But I think we have to think. Now, some of the trends of the last 40 years. The prevalence of autoimmune diseases has risen significantly over the past 40 years, with many diseases doubling or even tripling in incidence in some regions. Doubling and tripling over 40 years. That's scary. Now, some factors that might give more of this is more diagnosis. Probably could be better diagnosis, for example, but environmental changes such as pollution, lifestyle factors, which include diet, lack of physical activity. You see the westernized lifestyle coming in here. And then decreased exposure to infections. The hygiene hypothesis. In other words, if you're too clean, you're not exposed to bacteria, which help your body develop a strong immune system. So all these hand sanitizers people used the past few years, you've actually affected your immune system in the process. Left alone all the alcohol you put on your hands. Okay? Then aging populations can play a role. Possible genetic environmental factors can play a role. But yes, we are definitely doing something wrong in the westernized world. Otherwise, why in the non-westernized world you have far less, if any, autoimmune diseases? Makes you think. Type 1 diabetes, multiple sclerosis, rheumatoid arthritis, and inflammatory bowel disease have seen particularly sharp increases. How many people, even teenagers now, have got IBS? And that's not this is autoimmune disease, but it's linked to some of these bowel problems we have. Now, it's not a big stretch to take that into inflammatory bowel disease in the end. This can be a long-term problem. Point is, it's clear that autoimmune diseases are becoming more common, especially in industrialized nations. This trend is expected to continue as both environmental and genetic factors evolve. So we are exposing ourselves and increasing the risk ourselves. Nutrient deficiencies, you can do the research. I've done the research. And you meditate, I see, I quote the sources often at the end. I also got other sources. Okay? Nutrient deficiencies, vitamin A can lead to immune problems. Lack of vitamin A. Lack of vitamin B's can lead to immune problems. This includes other problems, or immune problems is one of them. Vitamin D deficiency lacks it's needed for stimulating, regulating the T cells production, and the T cells do the job and so on. So, not having the right nutrients can also mess up your immune system. Vitamin K deficiency, omega-3 deficiency. So you see, we are missing out on many things. Let's ask the question. Do you eat fish, oily fish, at least twice a week? I bet if I ask people to put their hands up, no hands will go up. And that's one of the problems we have. We're not getting enough omega-3s from our diet anymore. Iron is another one. Magnesium is another one we need. Selenium is another one. So these are nutrients. If we don't have enough of it, we can develop autoimmune diseases. Zinc. And zinc is involved in so many enzymatic reactions in the body. And so many people lack zinc. Our soils are depleted of these minerals, so our food is depleted of these nutrients. Now, how do you detect an autoimmune disorder? Okay, let's first see. It leads to destruction in our body tissue or change of body tissue. Okay, you can see the butterfly effect on the cheeks. That's now lupus, for example, the red coloration there. Okay, abnormal growth of an organ changes organ function. Now, if you've got these things, it could point towards an autoimmune disorder, pain and discomfort. Okay, so obviously they have to do more tests to make sure. Other symptoms, now that will vary depending on where the immune response is. Common symptoms include fatigue, fever, inflammation, joint pain, rashes, and just a general ill feeling. And organ function changes. Now, some autoimmune diseases like MS, for example, can flare up and then go away, and flare up and go away. That also get. And there are over 100 different types of autoimmune disorders already. And as I say, it's counting, it's increasing as well. So, we need to restore a healthy state of your immune system. And that is very important. Because your immune system has gone haywire, it's out of control, you need to somehow get it to normalize again. And we're going to discuss some of it very briefly tonight. There's obviously lots more information I can give, but then I'll keep it for hours, so let's just run through it very quickly. Treatment. Medical treatments aim to reduce the symptoms, control the autoimmune process, maintain the body's ability to fight disease, others who don't lower your immune system so badly they get infectious all the time, slows down or arrest the progression of the disease. Have you noticed? None of these indicate healing the disease or getting rid of the disease. Have you noticed? All about treating symptoms and not getting rid of the disease. Makes you think. The treatment depends on the disease. The symptoms may include medication to replace a substance the body lacks due to an autoimmune disease, thyroxine or insulin, for example, blood transfusions if blood is affected, and physical therapy as well. Side effects of medical treatment, however, intestinal bleeding, kidney failure, depression, psychosis, osteoporosis, infection, nausea, vomiting, stomach pains. Now, it seems the medical treatment can make you even sicker than your autoimmune disease can be making you. Mouth sores, and decreased appetite. Other side effects. Take note here. It says here there are two types of medications that can increase your chance of getting a fungal infection. Fungal infections. Corticosteroids, for example, as well as your tumor necrosis factor or TNF inhibitors. They affect your body and they're used for different types of autoimmune diseases, but they can lead to fungal infections which can be quite serious in some cases. Recommendations. What can you do? Now, if you want to prevent it, then obviously make sure that you are healthy. If you've got it, then make sure you get the right nutrition in to give your body a better chance of fighting the disease and getting your immune system back in balance. Okay, so follow an organic whole food diet. Stay away from GMOs, in other words. Follow an anti-inflammatory diet. Be careful of all your omega-6s. Yes, you need some omega-6, but canola oil is full of omega-6, for example. Margarine, those things. Stay away from those things. Seed oils, in other words. Check for hidden infections as well, which you might have. Check for hidden food allergens that you're not aware of. Get tested for celiac disease or gluten intolerance. Get tested for heavy metal poisoning. Change to non-toxic products. That includes personal products, home care products, etc. Because toxins can lead to autoimmune diseases. Get rid of those toxic things in the home. Others, detox your environment. Detox your food as well. People, you'll be shocked about what is in our food. The most toxic fruit is strawberries. And then just below that, you find things like kale and spinach and grapes and tomatoes, because the toxins are inside. You can't wash it off. And we think we eat healthy if we eat those things, unless you are organic. Fix your gut flora, because the gut flora is very important for your immune system, to get your immune system to be normal again. Detox your body, get rid of those toxins in your body. There are foods you can use to help you detox naturally as well. Exercise, sweat out some toxins and so on. Practice deep relaxation to get rid of the stress. Sleep enough. And introduce whole food supplements, because our food quality has deteriorated. We need to supplement to make sure we get enough nutrition in. Now, there's research show that exercise helps people with immune system problems. It helps you reduce inflammation, regulates your immune system, that's what you want. It increases the production of certain hormones, it strengthens your nervous system, it regulates your insulin levels. So those are all things you can do in terms of exercise as beneficial for people with autoimmune diseases. Prevention, modern medicine doesn't know of any prevention for most autoimmune disorders. Like I said, they focus on treating the symptoms. Theories suggest that lifestyle changes that promote immune system health may be beneficial. And that's where we come in, primary health care. Let's work on your body, get better health, so that you won't get that autoimmune disease. And if you do have it, that your body can fix the problem. A healthy lifestyle can make a big difference to your whole life. Recommendations: eat a whole food, anti-inflammatory diet. Others, cook from scratch. Don't eat only certain things. And if you're like me, I don't like certain foods, so I have to supplement to make sure I get everything in. And even if you do eat everything, your food's nutrition is in any case not what it's supposed to be, you have to supplement. Make sure you get probiotics in, omega-3 fatty acids, whole grains, coconut oil, good oils in other words, tea, dark chocolate, because cocoa is good for you, spices and herbs, red wine in moderation, eat organic fruit and vegetables. Go to the environmental working group and see what they say about the most toxic fruit and vegetables, the dirty dozen plus they call them. Vitamin D supplements lower the risk of autoimmune disease, researchers say. Look, I go through everything, but there are people that studied it, and they say if you increase vitamin D as well as omega-3 fatty acids with it, even better, you significantly lower the rate of getting autoimmune disease. And people with true vitamin D and omega-3 fatty acids lower the rate of autoimmune disorders compared to people with placebo. So the evidence is there. Nutrition makes a difference. More tips. Add green tea and turmeric and ginger to your diet. Healthy herbal teas. There's a nice herbal tea blend that we like as well. Avoid refined table salt. Increase of vitamins and minerals with a very good natural whole food nutraceutical multivitamin and mineral supplement, for example. Include these fruit and vegetables in your diet, because glutathione levels help to prevent autoimmune diseases. Sulfur-rich food like garlic, onion, parsley, and cruciferous vegetables, avocado, squash, and tomatoes, and denatured whey protein, and turmeric. Yes, use of turmeric, good for a lot of things. More tips. Eat plenty fresh orange, red, yellow, dark green fruit and vegetables because the carotenoids in there. Very important. Drink plenty purified water. Avoid toxins, avoid vaccinations, processed foods, preservatives, colorants, fizzy drinks, carbohydrates, GMO products, soy products, and alcohol, except a little bit of red wine in moderation. Leaky gut syndrome can be linked to several types of autoimmune diseases. So check if you don't have a leaky gut problem. Go on a detox and avoid trans fats. How about giving you food for thought here, and that's food to eat?
Hi, my name is Barbara Mosley, and greetings from Northern California. I'm a nurse and have been a nurse for 24 years. Out of those 24 years, I was a type 2 diabetic for 15 years and struggled with my blood sugar all that while. I was also diagnosed with multiple sclerosis in 2016 and then kidney failure in 2017. I was quite sick. I had high blood pressure, high cholesterol, and I weighed over 220 pounds. I could barely walk by September of 2017. But I want to tell you my story, and that through whole food, organic whole food nutrition and organic whole food supplements, I was able to eradicate all those chronic illnesses. I lost 110 pounds since then, and I not only live a good life and survived all those chronic diseases, but I truly am thriving. My cholesterol is normal, my blood pressure is normal. Within a week of changing my diet and my supplementation, I was off all my diabetic meds, which hadn't happened in 15 years. It was incredible transformation. It was an incredible journey to go from being so sick and hardly walking because of the MS, to going to the gym every day, to being able to participate in lots of sports, to be able to run around with my grandchildren, to really get my life back. And I am grateful. If you are suffering from chronic disease, I really urge you to embrace the organic, whole food way of life for your supplementation and for your diet. It will make a difference.
There are so many brands on the market. Question is, which ones do you take? Can you trust them all? Very good question. Because I can promise you, a lot of the supplements sold in the market can actually be harmful. I've actually got a video on my YouTube channel. Your supplement might be killing you. Go watch that video. Criteria for a good supplement. Firstly, avoid synthetic supplements. Research shows that whole food natural supplements work better, and some synthetic supplements can actually be harmful. Find whole food supplements that were tested on humans, that were researched, that does not contain artificial nutrients, made from non-GMO food, that if possible does not contain preservatives or artificial sweetness, that has a third-party seal of approval from a company without a history of lawsuits. You'll be shocked if you go Google companies, well-known companies, to see how many they've got lawsuits against them, and how many they have to settle out of court for millions. Makes you think. Note, higher dosages than just maintenance dosages are needed. Now let me explain something here. If you have got a disease of some sort, and you need to take a vitamin or some other nutrient to fight the disease, you need more than what they call the NRV, or the daily allowance. That's just for maintenance. Therapeutic dosages are higher. So very often people take good supplements, but they take low dosages, it will not help. You might have to take much higher dosages or much more potent supplements. Now the following supplements are recommendations. If you can find other supplements of similar quality, you can try them too, but I cannot vouch for those. And beware of imitations, because there are many products that pretend to be the same and they're not. Please note, the product suggested in this presentation complies with the criteria mentioned on the previous slide. These ones are not sold in pharmacies, health stores, and supermarkets to make them more affordable to start with. Contact the person who referred you for more information. Here are my recommendations. Find an all-round good multivitamin. Now, I use what they call the Fabulous 4-pack. Now, that's a packet that contains 4 tablets or pills in each packet, and 30 of them in a box, and it contains 4. One contains lipids and steroids, which you don't have in the food anymore. I'll talk about it more in a few moments. Carotenoids you find in red, orange, yellow, dark in fruit and vegetables. Your omega-3 cellulose oil, and multivitamin minerals and enzymes found in that Fabulous 4-pack. And then get a complete meal replacement shake. I'll give you an example of that. It contains 22 amino acids from non-GMO soy, whey, and other sources. It also contains vitamins, minerals, fiber, enzymes, and more. So let's talk about this very briefly. In that Fabulous 4-pack, what is in there? First of all, let's see. There's the lipids and steroids in there. The lipids and steroids that come from your whole grains, which have been removed from our food. In the Texas A&M study, university study, where this lipids and steroids were present, overall growth and development, nutrient utilization, and cardiovascular development improved. So it's not thumbs up. Research shows it. It's part of the Fabulous 4. It's not in the food anymore, because how many people still eat whole grains? You don't. People like white bread, white flour, etc., white rice. These grain concentrates are helpful for overall growth and development, nutrient utilization efficiency, in other words, how well the cells absorb nutrients. It improves them up to 50% for cardiovascular development, hormonal challenges. And here you see I've given you a wheat kernel there, and the problem is they remove the bran, they remove the wheat germ, and they basically end up just with the little starch portion from which they make the flour. And by the way, when they make the flour is off-white, they bleach it white, they add a pesticide and a fungicide to it, so bugs would eat it, but we eat it. We're very clever, hey? No wonder autoimmune diseases are on the increase. It helps also with depression or stress. It gives you energy, detoxifies the cells, detoxifies the body, aids the immune system, slows down aging, and for better sleep and for weight management. And it's not in our food anymore. Another industry first is carotene complex. I mentioned the red, orange, yellow, and dark in fruit and veggies. This is a pigment from those, and it's been shown in research that it boosts the immune system, but here is a clincher. It also normalizes and balances the immune system. So people with autoimmune diseases who are told, don't take stuff that boosts your immune system, don't worry. You can take this because it helps to normalize the immune system. And that is what you want. You want to normalize the immune system. Boost or balance the immune system. Lowers oxidation, therefore slows down aging as well. Lowers the risk of death from coronary heart disease, cancer, and all other causes. Stabilizes cholesterol, actually decreases the risk of dying from cholesterol-related disease by up to 500%. Lowers the risk of various cancers. And also, interesting one, if a pregnant woman takes this, it lowers the risk of the offspring developing asthma. That's an interesting one. Protects against cognitive decline. Reduces risk of getting stroke, of getting cataracts and macular degenerations, for bad night vision, strengthening for eyesight in general, better skin, protects against sunburn, and slows down aging. So many reasons to take this. Because how many of you eat between 7 to 14 portions of fruit and vegetables per day? And that's what we're supposed to eat. The colorful ones. You can shake your head. Very little of us do that, if any. So we're eating ourselves sick because we're not eating what we're supposed to eat. And even if we try to eat what we're supposed to eat, we'll be too much. We'll probably be too fat in the end, in any case. Just too much. Salmon Plus, another industry first, get one, contains all 8 omega-3s. All 8. Made from fish from the North Sea, from cold water. Made from the fillet of the fish, not the whole fish, just the fillet. Okay? Not the intestines, because that's where you find the toxins. And must be tested for over 200 toxins as well. Now, this specific one has been tested, and this research shows it lowers the inflammatory index in 8 weeks by 68%. No wonder it decreases your risk of getting so many diseases. But it also helps with circulation and cardiovascular challenges, for blood pressure, for sore joints and lower back pain, multi-cycle back pain, arthritis, healthy brain, ADD and ADHD, and hyperactivity, migraines, headaches, memory retention, mental disorders, depression, eczema, allergies. True, this is a mouthful. For digestion, IBS, enlarged prostate, better sleep, healthier pregnancies, and smarter and healthier babies. And this has been publicized as well in scientific journals, just like Keratin Complex also has been. Get a quality shake. Get a quality meal replacement shake. The one that I recommend has been publicized in scientific journals. It's even safe for diabetics. Glycemic response control studies. And what else? That's 18 grams of high quality protein, very highly absorbable, 5 grams of fiber, all 22 amino acids you need. Your immune system needs amino acids to make antibodies. And you need all 22 for that. It's got 25 vitamins and minerals, no gluten contributing factors, 9% plus lactose free, no preservatives, no sweeteners, and no artificial colorants. No artificial anything. No GMOs. PDCAAS score, that tells you how well that protein gets absorbed, probably the highest on the market, if not the highest. The typical shake the bodybuilders use is about 4 times less absorbable, the protein. That means they must have about 60 grams of protein in per serving to about equal this one. Makes you think. Those sugar spikes contain digestive enzymes. Furthermore, can be helpful for healthy pregnancy and morning sickness. Healthy and safe alternative for infant formula after a few months. Quick and budget-friendly meal replacement. Adequate and complete amino acid supply. All the amino acids. Kidney and liver problems. Interestingly, people with kidney problems can take the shake, and normally, if you have kidney problems, you cannot take a shake. Glycemic control and insulin resistance. Other people with diabetic problems, so on, you can take this. Increase energy and focus. Consistent performance and fitness improvement. You have sportsmen, in other words. Sustainable, fast-acting weight management program, part of that. And people with stomach reduction and gastric bypass, a shortened gut, you can use this to help you stay well nourished. Green tea blend of special blend of herbs in this tea. There's one that I like to recommend. My wife drinks this every day. Vitamin C from a whole food, but get a sustained release one. One that releases vitamin C over a period of 8 hours. And it must contain flavonoids as well, because it improves the function of the vitamin C. Take note, must be from whole food. Glutathione, you can find in the healthy shake I mentioned. Find in garlic alien products. Find in cruciferous products. And adding vitamin vegan D or vitamin D in other words make a big difference. A natural vitamin D. Go on a detox. Remove toxins from your life, from your body and your environment. Go on a detox. There's a 3-day program that's easy to follow. Speak to the person invited to you or show the video to find out more information about this. It's easy. There's a cleanse step for 2 days and 1 step to balance and energize again. Quick. Day 1 and 2, free the vegetable fast. Day 3, reintroduce production of healthy foods. Whole food based, no chemical drug-like substances. There's a natural purgative laxative involved. There's a garlic alum involved. There's a liver blood detox involved. And there's acidophilus probiotics involved. Speak to the person, like I said, we invited you if you want to get more information about this. And industry first again. the liver blood detoxer. Whole food-based antioxidant to protect against environmental toxins. Contains natural ingredients. Developed by Dr. Arthur First, double Nobel Prize winner in cancer research. Wow. Natural substance. And actually, this is so potent, you can't take it a week before and not a week after chemotherapy, because it kicks out chemotherapy. But that is why Dr. Arthur First developed it, to remove chemotherapy again from the body. Benefits. Detoxifies heavy metals and man-made chemicals like your chemotherapy. Is whole food extracted antioxidants, has 7 times for antioxidants. Good for people with bad night vision, for cataracts, for eye challenge, for allergies and skin issues. Just some of the things it's good for. But it detoxes the body, the liver and the blood. Now the industry first is your garlic allium and your acidophilus. Now I know acidophilus is not available in South Africa, but they planning on bringing it back. Hopefully soon be back in South Africa again. But these two, so important, they only start dissolving in the intestines, not in the stomach. Because the stomach acid destroys the good stuff in there. Your acidophilus, your probiotics. You know, these cheap probiotics you buy in the shops. Probably up to 99% of the bacteria in there, if they're still alive at the time you use them, will be destroyed by your stomach acid. Rather get one that's targeted delivery that will go through the stomach and then only start dissolving in the intestines. Now, benefits of garlic allium. Now, this specific product I'm talking about has got 5 families of allium to produce allicin, which is what you want. Target loaded, otherwise it goes through the stomach. Great for high blood pressure. Great for the immune system. Great for colon problems. For bad bacteria, in other words, get rid of bad bacteria. And helps your good bacteria in the gut to flourish. Great for getting rid of parasites. For your cardiovascular system. Great for the flu. For bowel movement. For bladder infections. So many good, positive side effects. Now, contrast this now with the medication. And all the negative side effects of the medication. Look at all the good side effects. Are the things I'm talking about here. What about a good probiotic? Acidophilus one. It contains 10 servings of yogurt, the equivalent of probiotics. It contains 5 billion lactobacillus. Again, enteric-coated, targeted delivery. Contains a whole lactobacillus family, okay? For bladder infections, slow stools, colon problems, depression problems, bloating, gas, allergies, and gut flora health. Remember I said earlier, gut flora health is so important for your immune system. Some people call the gut your second immune system. Other diesel supplements, vitamin D found in vegan D, Camber Plus D, New Life Bar, whole food supplements, vitamin E found in Norwegian oil, whole food vitamin supplements, aloe vera juice, so important. You find a good aloe vera juice. Long term. What can you long term? If you've got a problem, the Fabulous 4-pack, 1 to 2 sachets a day. Protein shake, 1 to 2 servings a day. Salmon Plus, 2 to 6 capsules a day. Protein complex, 2 to 6 capsules a day. Acidophilus, 1 to 2 capsules a day. The green tea blend, the one I recommend, 1 to 2 servings a day. The garlic allium, 1 to 3 tablets a day. Aloe vera, 50 to 100 ml a day. And even more. For a very serious autoimmune disease, you can even increase this. And unlike medicine, you can increase this quite a lot and no negative side effects. Here are the references. I want a thumb sucking. And more references. Okay? Now, why not join us in a quest to make this world a healthier and happier place? And also benefit you financially. I quickly sidetrack a little bit here. We normally talk about health and how to help your body fix problems and how autoimmune disease, what you can do to prevent it, healthy lifestyle, but also if you've got it, what you can do to help the body fix the problem. Okay? But so many people are suffering unnecessarily. So help us make the world a healthier and happier place. So very quickly, let me just talk about very quickly. If you want these products, speak to the person that showed the video invited you and ask them to become a promoter. And you can get 20 to 40% discount on the products. Now that's a bargain. Hey, Save money and be healthy. That's a bargain. You can register just to get a discount if you want to. It's also fine. But if you refer people, you can make money. So by helping other people be healthy, you can make some money. And by sharing the products, you can make people healthy as well and some money. And if you want, you can even replace your job in the process. That's if you want to. Here's some people, wellness sportsmen, and these are not only ones, many more. I must actually update this list again. But sportsmen that use these products that I was talking about, or some of them at least, some of these products. There's a skincare range that is 100% organic. Got the Cosmos seal as well. Because we're poisoning ourselves with our makeup and skin creams, all this stuff. And remember what I said earlier on? Toxins can be part of the problem why people have got autoimmune diseases. So let's help people replace the toxic stuff in their homes so it can help fight and prevent autoimmune diseases. Personal care, again, good personal care, shampoo, conditioner, honey body lotion, stuff like that. Home care range. I mean, people can think that if you have an organic or natural or non-toxic home care range, it can't be powerful. You must be joking. Look at that paving there. Because the Bible will tell you they used a non-toxic cleaning product, and you can see the difference. There's washing powders, there's softness, you can replace all the toxic stuff in the home. Why run the risk of getting an autoimmune disease by having all the toxic stuff in your home? Replace them and help other people also do that. So, what do I suggest? Use these products because you need it if you want to be healthy. Because by registering, you save money. You can educate it so you can help other people as well. And help other people save money as well. By getting them to register. Be a friend to other people. Share products with those who do not want to register and help them save money in any case, and in any case, to be healthier. Because that's the whole idea of tonight's talk. We want people to be healthier. I started off by saying autoimmune diseases are on the increase. So let's turn it around. So what are your options? Ask a person invited you for more information. Or say, I want to register as a promoter. Or in some countries you can register as a member for free and get a little bit less discount. I still save some money. Or if you don't want to register, buy it at full price if you want to, but get your health back on track. Why must we have unhealthy lives? Why must we call it stupid choices? Make wise choices for your health's sake. If you want you and your family to be healthy, it may be time for you to change your habits. So for more information, contact the person invited you to this Zoom webinar.